Warfarin. Introduction for new users. Introduction. Are all blood clots harmful? Select yes or no. Correct. Blood clots are helpful when they form to stop bleeding. Blood clots not related to injury can be harmful when they form and move inside the blood vessels, reducing blood flow. If the blood is too thin, is it more likely that a blood clot will form inside the blood vessels and heart? Select yes or no. Correct. If the blood is too thin, it is less likely for a blood clot to form, but it is more likely that severe bleeding will happen. Your blood will be checked on a regular basis by your healthcare provider. Patients who take Warfarin every day must take the pill at the same time each day. Select true or false. Correct. If you take Warfarin daily, you should take the pill at the same time each day. If you miss a Warfarin pill, should you add it to the dose of the next day? Select yes or no. Correct. If you miss a dose of Warfarin, do not take an extra pill unless less than 12 hours have passed since you missed the dose. Do not add it to the next day's dose. Green vegetables have a high level of vitamin K. Select true or false. Correct. Eating too much food with vitamin K may lower your INR. For this reason, you must keep the amount of vitamin K in your diet steady. Patients taking Warfarin should check with their healthcare providers before taking over-the-counter medicine. Select true or false. Correct. Other medicines can affect how thin the blood is. That is why you should check with your healthcare provider before taking any medicine. Do not take aspirin or aspirin-like painkillers such as ibuprofen, Advil, and naproxen, Aleve, when you are taking Warfarin, unless aspirin is prescribed by your healthcare provider. Internal bleeding is more likely when the blood is thinner than it should be. Select true or false. Correct. Internal bleeding is more likely when the blood is too thin. If you see signs of internal bleeding, such as dark urine or stools, call your healthcare provider right away. Minor bruises are a normal side effect and you do not need to call your healthcare provider. Select true or false. Correct. Minor bruises are normal and do not need to be seen by your healthcare provider. But large areas of bruising or unusual bruising are not normal, and you should call your healthcare provider if they happen. Thank you for using Explain.